Good afternoon. I'm Timothy Harrison. I'm with the Department of Health and Human Services, Office of HIV/AIDS and Infectious Disease Policy. And we are live streaming from the United States Conference on AIDS. And we have a few colleagues I want to introduce you to and talk to you about a few issues in HIV. And we're beginning with Gloria Searson, who is from New York.
Yes.
And she's here to talk about her panel discussion with us on HCV and HIV co-infection. And we're excited to have you here with us. Gloria, please tell us a little bit about why are you at the United States Conference on AIDS?
Hi, Tim. Well, thank you for inviting me. I was here at the panel just addressing hepatitis C and how we can take care of the co-infected patients, so the patients living with not only HIV, but hepatitis C as well. And I was trying to share some of my models, some of the things that we can incorporate into the best practices and enrich these very good HIV programs that we're here to celebrate today.
Great, great. And you've been involved in this field for quite a while.
Yes, let's not age me now.
Tell us about your experiences.
Well, I started working in HIV in 1992. I started on the ground level as a treatment educator / case manager. And what I learned was how to take care of people in spite of what things were available to me. And now with an abundance of resources, I feel like we should be doing a better job with our Hep C community inside the HIV community. And that's one of the things I wanted to bring to this conference, because the HIV community rocks.
Wonderful, wonderful. Now, we just left a panel session together, and there were programs that were discussed that were funded by the Secretary's Minority AIDS Initiative Fund, a way of putting into action many of the things that you talked about. Tell us a little bit what you heard that seemed to resonate with you.
Well, first of all, when the National Viral Action Plan came out, I was disappointed because it didn't have any resources with it. But as you look back 7 years, you say what it did was it established an infrastructure so that the partner organizations can put some things in place. So today what I heard was that 2 programs, the jurisdiction program and your other testing research collaborative that's going to identify gaps in services and sort of figure out how we can work Hep C into the existing HIV programs that are out there.
Excellent. In your conversation, you made the distinction between challenges and opportunities. Can you tell us a little bit about that, how this affects how we proceed?
Well, I'm a social worker, and I think when you come from the background of always having to take care of people who are considered marginalized and downtrodden, you have to give them whatever they need to get where they need to go. And I think what I always feel is if I have something as great as a cure, nothing should stand in my way. I mean, this is an opportunity to take a liver disease and just eliminate it from someone who could be suffering from not just HIV, but mental health, potentially going to have heart disease. And they might not even be living in a good place. So we can actually take one of their burdens and eliminate it in 8 to 12 weeks. And I think that that's what we should be focusing on.
Excellent. During your talk, you also referenced what we'll call a call to action.
Yes.
Where you really were encouraging health providers who work in the field of HIV, if they haven't already, to get involved in this field of HIV and HCV. Tell us a little bit more about what your charge is to folks.
Well, one of the things that we did with HIV is there were 1 million people estimated to have it, and we changed the way healthcare is delivered based on 1 million people. Now we're estimated to have 5 to 6 million people. And there is really no enthusiasm about how to establish something within an existing system or model that works. So one thing we did was we felt like knowing your status was key. And we didn't stop until every government agency bought into that idea and implemented those guidelines. So we should be doing the same thing around hepatitis C. We shouldn't be target testing because we miss people. My data at COPE shows that 20% of the people who tested positive denied ever having drug use. So if we just base it on targeting people, we're going to miss a whole load of people. And usually those are the people that are getting the new infection people are getting it from, those who are unaware.
Excellent, excellent. And as I mentioned, I work for the federal government.
Yes.
And what would you tell us? What are we doing that you think, or what should we be doing? You think moving forward?
You're going to do that on Facebook Live?
No.
Well,
honestly.
one of the things that I believe is that the patient has a voice, and that's another thing we learned in HIV. That people, you can have the medicine that works, you can give them everything it takes, but they must buy in. So if that's the case, I think where we could potentially be doing better with the government is as you get all your partners that are doing all this great work, encourage them to work with street level, ground crew, outreach workers, train them, employ them, and put them in a position to help their community. Because when you have a job and something good to do every day with your life, you do better physically, emotionally, and you want better things for all those around you. So one of the things I'd like to see is you establish programs that are designed to get funding into programs that have peer-driven exercises. And that could be in any disease state. I mean, even in recovery, I think we've learned through the rooms of recovery of Narcotics Anonymous that we are best people to help support us. And I think we need to support some models that look a little bit like that.
Excellent. You also, in your talk, spoke a lot about partnerships,
Yes.
collaborations, and it's a word we often hear in government and policy speak. Tell us about the importance, you believe, in collaborations.
We have to. I mean, people living with hepatitis C or the people living with cancer, HIV, depression. So whatever your special interest is, there's probably someone with hepatitis C as well. So the partnership is to do your part. If I'm in education, I want everybody in my school tested. If I'm in the fire department, I want everybody tested. It's almost like, let's just find out, because if you have, we got a cure. And so, guys, if you're not tested, get tested, because there's a cure for Hep C. And don't be ashamed if you were doing something 30 years ago and you might not want people to know because you're living differently. That's your burden to bear if you don't come in and get tested so we can give you access to the cure. That's really important, because there's a lot of us who are not unaware. We just were told something different before, and this isn't interferon anymore.
You're from New York.
I am. Harlem.
And you are the founder of your own organization.
Yes.
COPE.
COPE. Yeah.
Tell us a little bit about COPE.
It actually started with the evolution of the new direct-acting agents for Hep C. After working since 1998 in Coinfection, and not one person was interested in really working on Coinfection. It was almost like an aftermath in everything we did back then. I worked for this organization called NATAP. Shout out to Jules Levin, who I think does an awesome job in terms of getting the information out. So we worked together back then, and we went everywhere trying to motivate people to do what we're doing today. That was 1998. But the difference was the medicine was horrible. It didn't work for blacks. It didn't work for people over 50. It didn't work for people who had advanced liver disease. So now, none of those things matter. The treatment is actually effective on 95 to 100% of the people, regardless of your situation. You got to at least give yourself a chance. And that's the difference between then and now. That's why the opportunity is now.
Excellent. Excellent. And one last question. How optimistic are you about our opportunities to really cure HCV among HIV co-infected patients?
I believe if the people who organize the United States Conference on AIDS get involved in hepatitis C at the same level that they get involved with HIV, that we would help drive that, because the HIV community, and I love all of our advocates, they have done some amazing work. We changed the way healthcare is delivered. We established health homes. We actually made sure people understood that medicine is no good without a home and without food. And usually if you got cancer, people don't care. They give you a prescription and send you home. So in a disease like this, we've taught people to think differently about having a chronic disease. So the HIV community is key to making sure Hep C gets taken care of. But let's not exclude corrections, the veterans. We need all of us, because our patients are in your establishments, and all of the people receiving SAMHSA grants and OASIS grants in New York have the dubious challenge, because this is the majority of their population of needing your help, needing your resources, needing everything you can give them because they're sitting in their organizations.
Excellent, excellent. Well, I want to thank you for participating in our live streaming today. We really appreciate talking to us about HIV and HIV co-infection, and we wish you good speed.
Thank you so much.
Thank you. Thank you.
Hey guys, I just want to tell you about COPE, Coalition on Positive Health Empowerment. I'm from Brooklyn. Shout out to those of you watching from Brooklyn. I was born in Fort Greene. The office is in Harlem. We do direct service. We provide free screenings, education, support, and linkage to care. If you've been denied, call us. copehealth.org. Thanks so much.
Thank you, Gloria. And we know there's a lot of viewers out there watching us from all over the place, and I want to thank them. And we have viewers from Boston and Argentina and Pennsylvania and Brooklyn, as Gloria pointed out. We're also interested in how you are addressing HIV co-infection in your community. Let us know in the comments, please. And I now want to turn our attention to another important topic in HIV, and that's HIV and stigma. And later today at the U.S. Conference on AIDS, we're going to have a conversation with a bunch of important folks who will talk about how they are addressing stigma. And I actually am joined, I'm excited to say, by two new colleagues and older colleagues who will talk a little bit about HIV stigma. And I'm now joined by Gabriel Maldonado, who is president, CEO of True Evolution in California, as well as a member of the Presidential Advisory Council on HIV/AIDS.
Thank you.
Welcome. And we have Victor Claros from Virginia.
Correct.
Virginia, who is also going to talk a little bit about his experience around stigma, particularly in communities, during the session later today. And so welcome. I really appreciate you coming today. I want to start with you, Gabe.
Yes.
Gabriel. You have been in this field for a little while.
Yeah.
You know, you're a young person, but you're still a little while. Tell us about how you have come to USCA to talk about stigma.
So first, thank you for having me on here. Hello to all the viewers on Facebook Live. So stigma is a passion of mine, not only as a person living with HIV, but also as a service provider. And that's because stigma most often is found at the intersection of other discriminations, as it relates to people of color, as it relates to women, as it relates to our trans community. And these are the populations that are most often disproportionately impacted with disparities, with new rates of incidence, with higher rates of AIDS diagnoses. And so for me, stigma fuels this.
Okay.
And so to be able to come here to the U.S. Conference on AIDS and represent the President's Advisory Council to have a conversation on what the PACHA has done on stigma in the last year is something that I'm really excited to do.
Excellent, excellent, excellent. And Victor, well, we don't want to leave you out of this conversation. Tell us a little bit about how you come to this conversation around stigma.
Well, once again, thank you for the invitation
Absolutely,
too.
absolutely.
Thank you. In my case, I'm a person living with HIV for almost 10 years, for about 10 years actually. And in the Latino culture, it's actually one of the biggest barriers that we have, you know. In my case, I came out to my family about 12 years ago, and that was really, that wasn't seen well actually. You know, for my family, I'm the man of the family, so they weren't expecting to have a gay brother, a gay son. And then on top of that, some years later, I contracted HIV. So I was now double stigmatized, you know?
Yeah.
And they actually, I was really afraid. Now that I look back, it's like, my fear wasn't so much the fact that I had just been diagnosed with HIV, but how my family was going to take it. You know, what are they going to say about me? Are they going to accept me? Are they going to love me? And it was really, really, really painful. I actually, it had a very negative impact because I allowed myself to pretty much develop AIDS because I was so afraid to start taking medication. I didn't know anything, you know, how the side effects are going to affect me, what is my family, they will know. So it was really a very scary situation. So in our community, our Latino community, honestly, machismo and stigma go hand by hand, and you know, only gay people contract HIV. So I had all these crazy thoughts in my head, and once again, it really, luckily for me, I got to the point where I decided that it was time for me to take care of my health, and that's when I, you know, I didn't tell my family about it, but I started taking medication. So but it had a very negative impact in my life so at that point.
Excellent. You know, for many of us who've worked in this field for a long time, stigma has been a word that's been around for a while, and everyone has said, you know, we must address stigma.
Yeah.
Okay. There are often fewer concrete ideas about how we do that.
Yeah.
You know, and we're now at a really, I think, important opportunity to put concrete action in place to address stigma.
Sure.
Can you tell us a little bit how you approach that issue?
Yeah, so I like that you use the word concrete. And I would like to evolve that a little bit more and to say that our strategies and policies not only need to be concrete, but they need to be fluid. You know, and one of the reasons why I'm very passionate about the SMAIF, the Secretary of Minority AIDS Initiative Fund, is that it allows for innovation. It allows for culturally responsive and ethnically empowering innovation to be created, for systems change and for strategic collaborations. And so for me, like, as I approach working in particularly minority communities, I'm very conscious that, like, culture changes. You know, particularly as someone, I work with the youth population, and youth are evolving at a generational rate that even I cannot keep up with. And so when it comes to working with social media, when it comes to engaging in non-traditional clinical settings, when it comes to advancing our responsiveness to the Latino community, but understanding that the Latino community is diverse. You know, not everyone is Mexican, right? Which is kind of the overarching narrative of being Latino. Many of us from different parts of the country, whether you're in New York or the South or California, you're going to come from a different type of Latino experience. And as an Afro-Latino, I'm really passionate about looking at the intersection of those kinds of cultural identities and how we can create custom-tailored strategies that are concrete, but are fluid.
Okay.
And I think it's important for me.
Excellent. And you referenced the Secretary's Minority AIDS Initiative Fund, and I understand that Pacha had something also to say about it. Would you like to share?
Yeah, so the Presidential Advisory Council on HIV and AIDS, the PACHA, to which I'm proud to be a member of along with many of my other colleagues, we're very passionate, particularly as I am the co-chair of the Disparities Committee. So my committee specifically looks at disproportionate populations that are marginalized with the greatest level of disparities and social inequities. And so for me, SMAIF is a reflection of that. You know, it is a reflection of the need to establish federal, state-based, community-based organization partnerships for us to be nimble and flexible and adaptive to the changing landscape of HIV and AIDS as it relates to minority communities. So the PACHA is behind this. And so we wrote a letter of support to the Secretary of Health, Tom Price, and just to express our continued passion for the role, the instrumental role that SMAIF has played in our community and needs to play in the community as it relates to addressing issues in Black and Latino communities.
Wonderful. And in Virginia, Victor, you participated in a program called Care and Prevention in the United States, or CAPAS, and you did some work around stigma in Latino communities. Can you tell us about what that work was?
Sure. I'm actually an ambassador of a campaign called We Are Family, which is under Greater Than AIDS. And about almost 2 years ago, they were trying to recruit people, Latinos, so they could participate in the Somos Familia, We Are Family. And then I started asking people, because I was working in the field at the time. I'm a member of a support group for people who are HIV positive. So I asked a lot of people. I really had faith. I believed that not one, but at least 5 people were going to do it. So I started asking people around. No one wanted to participate in the campaign. So that actually took me to consider, maybe doing it myself. And then I had a conversation with my husband, and I asked him how he felt about it because his family didn't know that I have HIV, and that was another issue as well. Again, talking about stigma, you know. So I was really afraid. And as much as I love my husband, I actually had already asked him about 3 years ago, and I really didn't get. I'm sorry, I didn't get the support at the time. So it was really scary, you know. So because he was afraid also, he's like, I love you, but I don't want my family to reject you because of it. So. Anyways, I asked him again, you know, almost 2 years ago, and I said, maybe this is a sign. Maybe I should do it. You know, maybe I already was having the need of coming out to my family as well. I'm like, I mean, how can I? And I also question myself, how can I work in this field? How can I talk about stigma? How can I talk about combating stigma when I'm actually afraid myself to come out? So it was really, and I was actually struggling so much, and I got so depressed. And then one day I said, you know what? I love you very much, to my husband. And I said, but this is my time, I'm gonna do it, and I wanna do it big. So that's when I contacted them, and I said, we cannot find anybody else, but I'm gonna do it. So, and...
Do you mind if I make...
Yeah, please.
Victor said something quite powerful, is, you know, over the last few months, I've particularly been hearing stories from advocates who need advocacy. And this field is so often staffed by the people who at once need the very services that we now administrate. And so for those of us who are in the field, who are doing the advocacy, this is also about us. You know, we're not just advocating on some remote, you know, spectatorial external body. You know, this is also our lived experience. Like, we're still going through stigma.
Right.
You know, and so for us, this is also something that we are equally passionate about as individuals as well as advocates, I would say.
Excellent.
It was really scary for me. I just want to add, you know, I actually, it took me like almost 10 years to come out to my family with HIV. And once again, when I look back, it's like, it wasn't so much the fact that I was living with HIV, because I understand now that HIV is actually a treatable condition, but I was really afraid about not only what my family, but my kids, you know, my friends were going to say about me. Are they going to treat me the same? Are they going to be afraid that if they share a drink with me, they're going to contract HIV? So I was also struggling myself with internalized stigma. So, and I think I'm actually really happy that I made that decision, because it had a very positive impact in my life. I didn't want to go, you know, telling relative friend by friend about my HIV status. I'm like, no, I'm just gonna do it, and the videos are gonna be over there so people will know. And that actually saved me a lot of time and energy, and I don't regret it at all. I think it's time for all of us who have HIV to actually put a face, and this is the face of HIV, you know, Latino, black, white, you know, it could happen to anybody. It's just a treatable condition that didn't happen to me because I'm able. It can happen to anybody. So, and this is the best way to actually combat the HIV stigma, you know, by coming out again.
Great. And one last question I have for both of you, and you really have begun to touch on it. What does addressing stigma get us?
What's the question again? I'm sorry.
What does addressing stigma get us? Why is it important? What do we gain by addressing it? I mean, it seems like an obvious question, but I really want to. What do we get by addressing it?
It gives us freedom. It gives us peace. You know, it's really sad to see in my community people already are in the Latino community. People are stigmatized because they are Latino, because they're undocumented, because they don't speak English well, because we have an accent. Because they're gay and they have HIV, you know, and among so there are so many layers of stigma in the Latino community. So it will give us freedom, you know, peace of mind. I don't think it's fair for anybody to start treatment just because they're afraid that you know, what others are going to say. So honestly, that's the best decision. So it will actually bring our communities together. It will make you feel like you're not alone, because you're not. There are many of us that are actually HIV positive, and you know, so let's combat stigma together.
Can you answer that too, please?
Yeah, no, so just briefly, it humanizes the narrative about my people. And what that means for me is that stigma imposes a mendacity on the narrative of someone's life, that somehow you are unworthy. And as a service provider, I'm not only dealing with access to care, retention into care, treatment adherence. That's public health. The goal of addressing stigma is to humanize the story that you are worthy, that you matter, that your life means something and that you have every power in the world to lead a resilient, powerful life. And that's what addressing stigma does for me.
Wonderful, wonderful, wonderful. Now I know that we're going to wrap up now, but I want to thank you.
Thank you for
both of
having
you
us. Yes.
for a very brief but important conversation around HIV stigma. We look forward to your session later today. And I know that there are viewers out there. We'd love to know, how do you combat HIV stigma? Please let us know in comments. And I want to thank everyone for listening. We really appreciate you taking the time to listen to us today. And for more information on SMAIF, or the Secretary's Minority AIDS Initiative Fund, please visit hiv.gov. And thank you.
Thank you.